it's Jessica from Peterborough and the Kawarthas Chamber of Commerce. I am privileged to be here with Lesley Heighway, the President and CEO of the Peterborough Regional Health Center Foundation. If you're not familiar with the foundation, they provide funding and help raise funds for vital technologies and equipment for the Peterborough Regional Health Center. They've actually raised over $37 million in the past 5 years, which is huge, very exciting, and they provide equipment and technology for all areas of the hospital. So doctors, nurses, and it supports essential care for patients from all across the region. I saw in our chamber newsletter that was recently out that there is a new video series happening.
There is. We just launched a new video series called Heart of Healthcare, and it's an opportunity to meet with and interview people from across the region who are really shaping the future of healthcare here at Peterborough Regional. And we've met with these individuals in places in the community. We've gotten outside the walls of the hospital and met with them in places in the community that they've selected that are meaningful to them.
Amazing.
My first interview was Dr. Lynn Mikula, who is the new president and CEO of Peterborough Regional. And I asked her to share a little bit about her career. She began as a general surgeon and moved on to progressively more senior roles, now culminating in the president and CEO position here. And she shared a little bit about some of the challenges that we're all seeing in the healthcare environment today, and then of course the bold vision ahead here for Peterborough Regional and the work that the foundation and hospital are doing in partnership. And then you likely most recently saw that we have launched our second episode. So Bill Blair, who many of you will know, retired partner of a local accounting firm. And Bill spent, more than a decade on our board. He remains a volunteer to this day on a couple of our committees. And through his work at the foundation, and through a recent, I would say a frightening medical experience that he had, he's kind of seen the whole piece full circle. So, wonderful outcome. He's healthy. See him cycling, or you've seen him cycling on our most recent episode. But he had a lot to say about his medical experience and what it has meant to him to serve as a volunteer with the PRHC Foundation.
But I mean, you must be really busy with this new project launching.
It is, and I find, and I'm sure your other charitable sector members would agree, you get to Labor Day and it kind of takes on a new pace, and then you get to Thanksgiving. For those who celebrate Thanksgiving, it sort of marks the beginning of the giving season. And, it's a time when people start to reflect generally on their values, what's been important to them, charities that may have touched their life. Certainly we encourage, those in the community who have had positive healthcare experiences and where the healthcare has touched their life, to consider making a gift to the hospital foundation. But there's certainly no slowing down over this next 3 to 4 months as we, move towards December 31st. And, a lot of charitable giving can be influenced by that December 31st deadline. And certainly for tax receipting purposes, it's a major milestone.
Yep, that's right. I mean, it's hearing some of these stories. It must be so inspiring, and hopefully it can facilitate some giving this season.
The word philanthropy actually means for the love of mankind, and there's so much joy in the work that we do. You might not think that. I mean, here we are sitting in the hospital, but there is so much joy that I see every day. People, giving back for the wonderful care they've received, people honoring a friend or a family member by making a tribute gift, or perhaps honoring a medical professional who has, offered great care, been compassionate, maybe changed the trajectory of their life. But certainly, probably the best part of my role is working with our donors and being able to show them, very tangibly show them the difference that they have made in the lives of patients from all across the region, because we are a regional hospital.
Definitely. And I did hear that there is no government funding for the patient care hospital technology. Is that right?
Yeah, that is right. So the government funds a portion of hospital operations, but it does not fund the equipment and technology that the medical professionals here at PRHC use every day to deliver that great care. So, the $37 million that you mentioned right off the get-go, we do have a very generous community, and there is not an area of the hospital that I can walk into today without seeing the face of a donor. So, everything from emergency departments to cath labs, cancer care, every facet of cancer care, laboratory, diagnostic imaging, the cancer care unit itself, premature infants, equipment on the medical wards, It's just absolutely transformational what donors have been able to accomplish. When you're talking about medical technology, I guess I'll liken it to my iPhone or to your iPhone that you're filming that you're filming with here today. Like our own personal technology, medical technology has a lifespan, and it's usually 7 years, 8 years, and by that point, it's either worn out and run all the tests that it was meant to run, or new technology is available that just frankly enables the physicians in the building and nurses to deliver better care. So, investing in that future of healthcare just enables our hospital to do a few things. It enables it to fuel innovation and to bring those new life-saving services here, because it's never, when you're replacing technology, it's never replacing like with like. It always comes with better technology, more capability, more services that you're able to launch. And I guess a little known fact is that medical technology actually plays a really key role in physician recruitment.
Right.
So when physicians are, graduating and have completed their residency, they're looking, trying to determine where they wish to work. As much as the hospital is interviewing the physician's also interviewing the hospital, and they want to be able to deliver their best possible care that they were trained to deliver. And certainly medical technology does play a role in that. So, we're incredibly grateful to our generous community for, getting us to this point today. And like I said, the vision is bold in terms of where we're headed.
Well, that's right. I mean, it's a lot of technologies that I imagine a lot of people wouldn't even hope to see in their lifetime, but unfortunately they have to. So how can people help the foundation and help the hospital?
I guess there are a number of ways. Probably the easiest way is just to become a monthly donor. It's an automatic way to give every month. What it enables us to do is just to be really responsive to the hospital's needs. So, if there's an urgent hospital priority, all of our monthly donors collectively enable us to be responsive. You may have an appeal letter coming to your mailbox now or soon. You can certainly give by mail. You can go online to prhcfoundation.ca. You can call our offices, 876-5000, to make a gift, and someone would gladly help you to do that as well. At this time of year, we do have many people thinking about what we call tribute giving. So tribute giving is potentially honoring someone or honoring a caregiver, a physician, staff member. And at this time of year as well, so, we all have those people who are difficult to buy for as we get into the giving season. And
I know what you're talking about.
Oh yeah, I know. Sometimes parents and grandparents who have everything, they'll tell you that they don't need anything else. But making a gift to the PRHC Foundation is a wonderful way to give back and to honor them and making a gift in their honor as well.
Lesley, thank you so much for inviting me here so we can chat about the foundation in the Learning Center in this beautiful space. I really appreciate your time.
Oh, thank you so much for being here and for the opportunity to share just a little bit about what our donors have accomplished here at Peterborough Regional. I appreciate it.
Thank you.